Assalamu alaikum wa rahmatullahi wa barakatuh. MERS coronavirus emerged in 2012 as a serious and growing public health concern. The virus was quickly identified as a new or novel virus that had the potential to become a global threat to humanity. While the virus cannot be seen except with an electron microscope, physicians and researchers were able to identify the virus as novel, at first due to the catastrophic symptoms in initial patients identified, and later by isolating and identifying the unique MERS coronavirus molecules. Since then, MERS coronavirus has been confirmed to have infected 834 people globally, with 319 of those people dying. A case definition helps healthcare providers define who should be considered for inclusion for interventions during any outbreak investigations. In the case of MERS coronavirus, the symptoms and conditions that differentiate the virus from other diagnoses are common. To further complicate the matter, not all people who are infected with the virus are symptomatic. Some people will never show symptoms at all. The Saudi Ministry of Health has developed case definitions for MERS coronavirus that are in line with the World Health Organization and other medical associations throughout the world. These categories are meant to assist healthcare workers in triaging potential patients or carriers of MERS coronavirus by their risk of the disease or for spreading the disease. Based on that, patients fall into one of two categories. They are either a suspected case or a probable case. If any patient of the previous two categories has a positive test for MERS coronavirus, he is then called a confirmed case. We will go over each definition. A suspected case of MERS coronavirus is someone who shows clinical signs and symptoms that are compatible with what we currently know about confirmed cases. Currently, we suspect 4 groups of people, all of whom should be tested for MERS coronavirus. These include a person with fever and community-acquired pneumonia or acute respiratory distress syndrome based on clinical or radiological evidence, or a hospitalized patient with healthcare-associated pneumonia based on clinical and radiological evidence, or a person with acute febrile illness, temperature more than 38 centigrades, and body aches, headache, diarrhea, or nausea and vomiting, with or without respiratory symptoms, and unexplained leukopenia of WBC count of less than 3.5 times 10 per liter, and thrombocytopenia, platelets of less than 150 times 10 per liter. Or lastly, a person, including healthcare workers, who had protected or unprotected exposures to confirmed or probable case of MERS coronavirus infection, and who present with upper or lower respiratory illness within 2 weeks after exposure. Any person who fits the suspect case definition should be tested for MERS coronavirus. The next category is that of a probable case. With probable cases, patients carry more risk due to having had close contact with a confirmed case. A probable case would be a patient in Category 1 or 2. Category 1, a person with fever and community-acquired pneumonia or acute respiratory distress based on clinical or radiological evidence. Or Category 2, a hospitalized patient with healthcare-associated pneumonia based on clinical and radiological evidence. But in this case, that patient also is a close contact of a laboratory-confirmed case. This category would include healthcare workers who work where confirmed MERS coronavirus patients are being cared for. Even in the absence of a conclusive laboratory result, this patient would be considered a probable case. A confirmed case is a patient with laboratory confirmation of MERS coronavirus infection. Real-time PCR assays are used to detect MERS coronavirus viral RNA in samples taken from patients. Multiple samples should be taken for testing from upper respiratory tract, such as nasopharyngeal samples, as well as stool. If the patient is intubated, then lower respiratory tract, such as bronchoalveolar lavage samples, should be taken. Therefore, we can only conclusively say that a patient is a confirmed case once the laboratory tests have yielded a positive result. Knowing those who are infected and ruling out those who are not will prevent wasted resources, undue stress, and ultimately illness and death. By being prepared and responsive, we will be able to respond swiftly and efficiently. It is important to remember that you are not alone in your decision-making. There are specialized teams to help you, and it is important to keep them informed.